Hi, everyone. Welcome to today's webinar, What Patients Need to Succeed. I'm your host, Jenna Invalo. Before we get started, I wanted to take a moment to thank our sponsors, Alexion, Argenx, Regeneron, Johnson & Johnson, and UCB. And I also wanted to let you know that you are able to turn on captions for today's webinar if you would like to by clicking on the closed caption button in the bottom corner of the Zoom, and you can select English as your language. Now we've got a great presentation, and it's my pleasure to introduce today's speaker, Levi Peterson. Levi is a rare disease advocate from South Central PA, impacted by secondary intracranial hypertension, Behçet's disease, and Parkinson's. Levi has undergone 10 major brain surgeries since their initial diagnosis in 2016. As a former firefighter EMT, Levi gained invaluable firsthand knowledge of the healthcare system that would become the building blocks of both their patient journey and career. This clinical and practical knowledge was instrumental to diagnosing their own conditions when doctors fell short, and also assisting other patients with navigating the healthcare system in the present day. Levi is currently the storytelling and community experience designer at Patients Rising, is a member of the board of directors at GPACT and One Rare, contracts with Medable as a member of the PCN, and lends their voice to podcasts and learning institutions in their free time, with the ultimate goal of decreasing the diagnostic odyssey and creating fun and educational content that is made by patients for patients. Levi is tirelessly working to develop programs and creative solutions to improve the lives and outcomes of patients everywhere. Welcome, Levi.
Thank you so much for having me.
Yeah, it's a pleasure. So today's format for the webinar is something a little bit new for us, and we're going to go through some Q&A to really help best understand some of these key points about preparing for medical appointments, asking the right questions, advocating, and really being empowered. Is that right?
Absolutely. I think that's honestly the most important thing about being your own best advocate is really being able to leverage your appointments and your experiences and all of that knowledge that you've collected on your journey to make your healthcare work for you.
That's great. And throughout the presentation, if you in the audience have questions, you can submit them in the Q&A box located at the bottom of the Zoom screen, and we'll work on answering those as well. So let's dive into preparing for medical appointments. What steps do you take to prepare for a medical appointment to ensure that you make the most of your time with your doctor?
So the first thing that I like to do is really hone in on what my pain points are, especially since I'm dealing with now at this point 3 rare diseases. I really have to take time to think about how my conditions overlap and what those complexities might look like. And for me, one of the things that I found really, really helps to kind of debulk that process and make it a little lighter is I actually take all of my medical records and I plug them into AI and I get my bullet points for what I need to talk to my doctor about right then and there. It really helps you cut down through your story because what's the question every doctor asks that throws us all off? How did you get here? And that's when all of us completely forget exactly what we were going to say. And then we really just have that spaz moment in your brain where you're not able to really answer. And then you kind of worry, hey, am I getting to the point that I want to with my doctor today?
That's fascinating. That's a really interesting suggestion. In terms of AI, is there a specific platform that you use, or how could somebody
I love
who's
Perplexity.
okay?
Perplexity's been fantastic, but honestly, you could still use like a Chat GPT alternative, anything like that. I think it's really all about the prompt, right? You want your AI to be able to imagine what it's like to be a patient. It's all about what you're putting into your AI to get the most output for you. It's all about making those tools more leverageable for your situation.
That's really interesting. And how can patients organize their thoughts and concerns before an appointment, especially when managing multiple health conditions or complex ones?
So there's actually a few different templates that have been put out by Alexion, also More Than MG. I think that's also a campaign that they put out. But there are templates that can help you organize your questions and really have that health literacy and be able to speak to your doctor on their terms, on their turf a little bit. That way, there's no guesswork in between what you're saying and how the doctor's interpreting it. And also, I recommend putting together a full timeline of your conditions, how it's progressed, especially once you identify, okay, I'm going to my doctor today because I realize maybe my vision is really starting to go. Maybe I realize my tremors. Maybe I realize that my muscular issues are really starting to be more impacted. When you really start to take a look at what that means for you and what abilities have recently decreased and really judging those ADLs, that's where you're really able to decide, okay, what do I need to prioritize? And then how do I make a timeline out of that to where when my doctor asks me about a certain point in my healthcare journey, I'm not going to get thrown off.
And what tools or methods do you use to track your symptoms or changes in your health between visits?
So for me, I'm the kind of person, being the millennial that I am, I love using my Apple iPhone notes. That's probably the first place that I put everything. And then since that's written, I can then take that, copy it into a document, and that's when I plug it into AI.
That's great. We also on the MGFA website have an app that specifically tracks symptoms for MG. So several of our community
Yes.
members use that, but can access that as well.
And it's a fantastic app. I was looking into it while putting this webinar together, and truly, it's definitely something you guys need to download.
Thanks. And so the next thing is when you're going to see the doctor, sometimes you have a really limited window of time that you're able to connect with the provider. How do you prioritize what to discuss during the appointment?
Well, I mean, once again, when you're really thinking about those pain points and what to prioritize, it's what is impacting my life? What's impacting my ability to work? Is it impacting my ability to get out of bed? Am I eating regularly? When you really start to think about how much you are able to do and what feels comfortable for you, I think that's where you really need to prioritize and decide right then and there, okay, this is something that is officially cut into maybe the hobbies that I find myself always trying to do, but maybe I don't have the energy anymore. Maybe I'm not seeing my friends as often. Maybe I can't see my family all of a sudden. When you start to take a granular look at those issues, I think that's one of the things that can really help you decide which points to prioritize. It's really about what matters to you as a person and as a patient. Everyone's different.
Really helpful. And so after you've kind of spent the time preparing for the appointment and getting ready to go in, let's dive into asking the right questions for you or whoever it is that's going into their appointment. And what would you say are some of the key questions that patients should ask their doctors to help better understand their diagnosis or treatment options?
So I first like to start by asking any of my providers what they already know about my conditions. Because the first thing I need to figure out is this someone who is going to be the right amount of equipped to help me if there's going to be an emergency? How much do they understand, or am I going to have to spoon feed? Because if I have to spoon feed, that might be a situation where time is of the essence. They're maybe not going to understand that I need things to move a little more quickly. So I really like to gauge more about the provider first. On that first initial hour, it's really me trying to feel out, okay, what type of provider is this? Is this someone who's going to work with me? Are they going to look at me like I have five heads if I ask for a different medication or if I ask for a second opinion, and really kind of go from there? And that's when I like to ask more about any kind of side effects I need to worry about, how my conditions might have any sort of interplay with the condition I'm there talking to them about. So you really want to go down and make a list for yourself, which we will be showing resources at the end of this presentation, and I do have a lot of templates included in that.
That's great. I think one of the things we talk about a lot at the MGFA is the importance of finding the right neurologist for you and for your journey.
That's huge, very huge.
We have resources on our website that we do provide a list of neurologists that specialize in MG that the MGFA has vetted and understands that they have awareness and are up to date on the latest treatments and options for the community. And then another thing that we offer for really anyone, but especially people who might still be looking for the right neurologist, is a list of educational materials that highlight different treatments that are available for MG, as well as potential side effects. And we encourage that as a resource that you could bring to your appointment and share with your provider, especially as you said, if it's somebody that you have to spoon feed a little bit more information to.
Especially, yeah, especially. And you really want to always ask about your treatment options, your alternatives. I will never hammer this home enough. The most important thing to focus on when being a patient is what are my options? That's the most important phrase throughout your entire healthcare journey. If you take away one thing from this webinar today, asking what are my options? That is the one thing that will give you freedom as a patient, and I truly mean that.
That's great. And what are my options is a great segue into some of the other topics
Yeah.
that can come up with asking the right questions when we're dealing with topics that can be sensitive about medication, side effects, or financial concerns. How can patients have those types of conversations during their appointments?
The first thing I want you to understand is that you don't have to talk to just your doctor about everything. Sometimes the PA that comes in and talks to you, sometimes the nurse who's coming in to take your blood pressure and kind of hear about some of the pain points that you're dealing with, even the person you speak with at the end of your appointment, your scheduler. These are all people that you can ask a lot of these questions to, especially since they tend to fall under a little bit of that administrative area, especially when you're looking at the finances, the medications, the alternatives. Those are things your doctor's probably going to end up pushing you more in their direction anyway. But if you're someone that feels very comfortable and very confident speaking to your doctor, which you kind of should, if you're ever in a situation where you have a doctor who maybe you're not as comfortable with, that's when it's time to reevaluate and say, hey, me as the patient, I'm the one who hires my doctor. If maybe I'm not feeling comfortable, if maybe the vibes are off, it is okay to fire them and get someone new.
Mm,
So if you're not comfortable, ask yourself why, and then decide if it's time to reevaluate.
yeah, but there's a
But for
lot of
phrasing
awareness.
the medication stuff, I highly recommend just being honest. I feel like a lot of times as patients, we are so gaslit by everything, including ourselves, that simple questions become the most daunting thing in the world. We automatically assume that we're going to have every single person's judgment, and you never know when you might get that one really cool doctor that's going to be like, you know what? My other patient said that last week. I completely get it.
It's really insightful. And what would your advice be for asking about alternative treatments or second opinions so that you don't feel uncomfortable when you're asking those questions?
Once again, if you're in a situation where a doctor, for any reason, would make you feel uncomfortable or even take it personally when you're asking about a second opinion, they're not the doctor for you. Just point blank, period. They're not the doctor for you. That's when you need to find someone who's willing to work with you a little bit more, especially because when you're dealing with these really rare conditions and you have all of this different crossover in how these symptoms play out and how they look and how it affects you, you really need someone that's going to understand that you need options as a patient. Options are literally the only thing that are going to end up actually creating a quality of life. It gives the patient the control back that they lost the day they were diagnosed. So that's really something to keep in the front of your mind.
It's really important. I think it's really important to hear. Um,
But one thing that you can do is you can always go through my chart. You can always ask for clarity on things. You can always ask for a second opinion through my chart because the one thing I have learned about my chart, especially if you're dealing with any of like the patient portals, usually it sends it to the whole team, not just the doctor. That's why anyone and everyone will respond to your request except for your doctor. So the pressure's kind of off if you're typing this into my chart, you're realizing the whole team's going to see it at this point anyway. So it's like cat's out of the bag. You can just kind of type it in there and not really have to think about it that much, right?
that's really helpful. It's a little bit different than having to keep calling the office and ask.
Oh, no one likes calling the office. I mean, me being the millennial I am, I don't even really like having to text people. So trust me, guys, I understand.
Well, great. Let's talk a little bit more about being an advocate for yourself and what that can look like.
Yeah,
So
absolutely.
what does advocating for yourself as a patient look like in practice, and how has this helped you in your healthcare journey?
So for me, honestly, it was not a linear journey, and it was not something that came easily. I think it was really about finding my voice and being able to be unafraid of showing my confidence and being unafraid of being the expert. I think a lot of times we as patients are kind of shamed out of being the expert. And I think that's kind of dangerous because if the patient isn't the expert on their care and their body, at that point, really, who is? So for me, I always felt like being able to have a sense of confidence when I'm speaking to my doctors and really taking the time to research and understand my body and my condition. I know for me, one of the things that I always said, especially when going through getting diagnosed with my conditions, was really trying to find different ways to think about my body, to make things make more sense for me. And so I would say for anyone listening, the biggest thing for you to take away from this is having that sense of confidence and not being unafraid to be honest with yourself and with your care team, not shying away from the more difficult and more vulnerable and sometimes more embarrassing topics, because at the end of the day, it's your life and what you put in is what you're going to get out.
It's really helpful. And how can patients ensure that their voice is heard when they feel that their concerns are being overlooked?
That's once again that point where you have to decide as a patient, do I want to keep continuing with this care team? If I'm going to continually be overlooked, if I take a second to look at my feelings and to look at how my care is being addressed and I'm not satisfied with that, we know something's wrong. If someone makes you feel less than for caring about your health care, if someone makes you feel less than for worrying that something could be wrong, if you have this one random little symptom, you kind of have to ask yourself why and then allow yourself the authority to say, hey, I'm done with this. Let's get the right care team in order. And if you're overwhelmed about doing that, there are a lot of great resources out there that can help.
And then when we look at advocacy, we talked about advocating for yourself, but another key player for a lot of rare disease patients and myasthenic patients is the role of care partners.
Yep.
What role do care partners play in advocacy, and how can they best support patients during appointments?
Care partners honestly play one of the most integral roles in healthcare, in my opinion, because when I think back to the early days of my diagnosis, my mom was with me for every appointment and still is to this day. And this is someone where if, God forbid, I'm getting delivered bad news and my brain turns off because, I mean, hi, hello, trauma, she's going to be the person with the legal pad taking the notes and making sure that we're not missing anything. So I think being able to have a care partner on a day when you know, hey, this might be an appointment that could be a little heavier. This is something that is going to be a lot more technical. Maybe I should have someone with me that day. This is someone that in those moments when maybe you do feel a little bit left out by your care team or like your voice doesn't matter, this is someone who can be like, hey, wait, we have something that we want to go over. It takes that pressure off of you. So if you're someone where maybe you're not quite ready yet to be like, you know what, you can have that one person with you that can help, I would say, put your pain points into something that makes sense for both you and your care partner. And this is the person that knows you like the back of their hand. This is the person that has been with you since day one. So I think especially being able to take that person to primary appointments, this is someone that they're going to be able to ask, hey, has so and so been eating right? Have they been acting right? It's something that is going to be able to paint more of a picture for the doctor. And I think it gives them more of an opportunity to ask someone who's either living with you or has been around you and knows you well enough, hey, how worried should we be? Like, what stage of worry should we be at?
That's amazing. And I think that another really valuable piece of what you're explaining is just how that care partner is there with the person during kind of the highs and the lows. So they know, I think
Yes.
sometimes there's a different set point for what a good day is for someone versus what a bad day is. Even if a provider asks someone, I know I've seen that firsthand, people will tell their care partner how terrible they're feeling, but then when they get in front of the provider, they're like, oh, no, I'm fine today. Um,
I've been that care partner even for my boyfriend who suffers with rare illness, and he's always been someone who's more shy and a little more afraid of talking about the things that are more uncomfortable. So in those appointments, I've always been but you were talking about this the other day, and you were really, really sick a couple days ago, and like trying to kind of put more of that out there, to where you're not dominating the conversation. I think the focus should always be on the patient, but when you're able to once again spoon feed a little bit and give a little more context and paint a fuller picture for your provider genuinely wants to understand. They want you to paint a big, beautiful picture with happy little trees and all that good stuff. They want to know everything. So the more you have at your disposal to do exactly that, the more you are going to get out of that appointment. That is like the most important thing you can remember.
That's great. And it sounds like having awareness of how to be your own advocate and how to have a care partner as an advocate is great and would hopefully result in a really productive meeting with your provider. But there will still be some challenges that can come up. So let's talk a little bit about how to navigate those. Um,
Absolutely.
so, what should patients do if they leave an appointment feeling confused or unsure about the next steps in their care?
So it depends on at what point you've realized, okay, I still have things I need to ask. If your foot is already out the door, feel free to do a nice little 180, go right back in there and talk to the receptionist, ask some questions, talk to the on-call nurse. Now, granted, you can do the same thing via phone literally when you get home or the next day, but there's not always the possibility of them being there and having the time to call back. So if you're already there, I recommend just going right back in and speaking to whomever you can on call. But if that's not the case, I would definitely give a phone call straight to the office. You can then talk to the on-call nurse, and usually they'll have a little more time to talk to you, break things down. That might also take some of the pressure off of you. Or once again, if you're anything like me and you like using my chart or your patient portals, that is another place where you can easily put in, hey, I still feel a little foggy on this, and this. Could we clarify that, please? And then you'll get probably an answer within, usually it's 24 to 48 business hours, depending upon your provider. But for the most part, it's good. Not for anything that's emergent. If it's emergent, seriously, either call the office, call 911. You guys know.
That's great. And how do you handle situations where you disagree with your doctor's recommendation or maybe feel like the goals weren't aligned?
That is a situation where you call your insurance and ask for new providers. You ask for a printout list. If you feel that you are not aligned, if you feel that this is a provider that is not going to work for you, you as the patient are the boss. You get to fire that provider if you really don't feel that that is something that's going to work out for you. Now, I always say to try to give a little bit of leeway in different situations. You're going to know what works best for you, but sometimes there is a little bit of payoff for bedside manner to genius ratio. I have noticed, especially in the neurosciences area.
Well, that's great. Now that we've talked about kind of navigating some of these challenges, let's dive into how we can make sure that we are empowering patients and having a positive outcome as often as we can.
Absolutely.
So, what advice would you give to someone who feels intimidated or overwhelmed by the healthcare system?
I would say that that is a completely valid feeling. And I would tell you that everyone else around you probably all feels the same way. And I hope that makes you feel a little bit less alone in that. But The other thing that I have to offer you is the fact that there are a lot of resources out there. And if there's one thing I can say in the course of putting together the accelerators and everything else, there is an abundance of resources for MG. This community is truly top notch. And it's so amazing to see, especially in a rare disease community, to have so many resources, regardless of what the issue might be. So that is something that I would definitely lean into. I would take the time to really figure out what your needs are going to be, look at some of those resources, because whether it's an administrative burden, a financial burden, there is something out there for everyone.
You mentioned Accelerator. Can you share what that is for the rest of the community who
So
might not know?
yes, that is the Patience Rising Myasthenia Gravis Accelerator. And we have been putting this together basically to be somewhat of marriage counseling between doctor and patient, really trying to find those pain points and being able to translate patient speak to doctor speak and vice versa. And we will definitely have more updates on that coming soon.
That's great. Thank you. Um, are there strategies that you found helpful for staying organized and proactive when managing one or multiple health conditions?
Calendars. So many calendars. I cannot stress this enough. So I know this is not going to be something that everyone can do, but I even recently started using Motion to be able to plan out my weeks as far as which doctors I need to see, which people I need to call. Because I think for me, the most stressful part of having to manage all of these different conditions is all the appointments, all the tests. The administrative burden on the patient is so profound, and I think that is a huge reason for burnout. And if you're someone who, like me, probably is going through that burnout phase, I want you to know that you're valid in that, and everyone is entitled to a burnout phase.
Thank you. And if you could share one piece of advice with other patients about taking control of their healthcare journey, what would that be?
When it comes to taking control of your healthcare journey, it's really a matter of confidence in self, confidence in your voice and knowing your body, and not being afraid to be that patient, not being afraid to speak up when it's necessary. Because at the end of the day, you are the only person that can be your own best advocate unless you have a really, really awesome care partner. In that case, amazing teamwork.
That's great. Thank you. Um, well, now we'd like to see if there's any questions from the audience. And while we're doing that, Levi, do you want to pull up the slide that you have with some additional
Absolutely.
resources?
Okay. So we prepared this. This is actually a link tree that goes to a full organized spread of all of our best resources that we came across while putting the Myasthenia Gravis Accelerator together. Now, this is including support organizations, this is including financial resources, anything for caregivers, including respite services, things of that nature. So I implore you guys to go ahead, scan it, take a look through. I know personally from working on the helpline as many years as I did that for me personally, I realized no one hates getting an email with just links more. So I figured, hey, if we at least put this in a link tree, I think our eyes will thank us.
That's great. And we're working on putting the URL in the chat as well so that we can share that with anybody else who needs it. Can
And the
you,
early access version, by the way, of the Myasthenia Gravis Accelerator is the very first link on that link tree. So it is early access. There's still a lot to be added, but it is in progress.
that's great. And Levi, can you take just a minute and explain a little bit more about Patients Rising and what the organization is and then your
Yeah.
role there?
So, Patients Rising is a disease agnostic organization that specializes in policy and advocacy. We actually have a community that you can join, which is also accessible through the link tree. But there you will find an advocacy hub, our Patients Rising masterclass, our Be Your Own Best Advocate masterclass, as well as many other different events, advocacy call to actions. I mean, this is a community that is closed, that is for you guys to talk about anything related to advocacy, caregiving, your patient journey, all that great stuff.
That's great. And can you share a
And
little
as
bit
far
more?
as Yeah, as far as my role, so I have actually worn many, many hats in this organization. I officially started as the patient helpline resource coordinator back in the early days. And now what I do is patient interviews. So if you are someone in the myasthenia gravis community who is looking to maybe share your story for an on-camera interview, please reach out.
That's great. Thank you.
And I can drop my email in the chat also. That
Thank you.
way, if
That was
anyone would like
perfect.
to reach out, you absolutely can.
Um, and for those of you who maybe don't have the ability to hold on to all this information right away, we will have a recording of this aired after, and it'll be posted on the MGFA website and on our YouTube channel as well. So you'll be able to refer back to this.
Oh, and as far as my time with the patient helpline, so when I initially started, I was doing resource coordination, which is how I was able to happen upon a majority of these resources that I put together for you guys today. But we basically had started back in COVID-19, and I actually had gotten my start as a patient navigator. So I would answer phone calls and emails from patients every day. So we were pretty much the boots on the ground to be able to inform Patients Rising of, hey, these are the issues that are impacting patients, and this is how we want to address it. But it's cool to be able to shift into more of the storytelling role because I do love getting to hear patient stories.
That's incredible. Well,
Thank you.
th thank you so much for your time today and for sharing your personal insights and experiences with the community. And also thank you for all that you're doing for Patients Rising. And we look
Thank
forward
you.
to collaborating with you further.
I look forward to collaborating with you all as well. And thank you to everyone who attended today.
Thanks, everyone. Take care.